Hi, it's Dr. Luke Pogue, and today we're going to talk about prostate cancer screening. This is a topic I bring up with men over the age of 50, sometimes earlier if they're in a higher risk group, at their annual wellness visit. Prostate cancer is the second leading cause of cancer death behind lung cancer, so in the 1980s it began to be recommended to do a blood test called a PSA as well as a rectal exam annually in men over 50, sometimes earlier. This did in fact catch cancer in more men. About 30% more cancers were detected in men who did the screening versus not. However, the chance of dying of cancer did not decrease as much as we had hoped. In fact, there was a study that tracked men over an 11-year period that found the chance of dying of prostate cancer was lower, but only slightly lower. The chance of dying of cancer in that study, cancer of the prostate that is, was 0.5% if you did not do the screening and 0.4% if you did. So really a pretty small benefit, and they found tracking 781 men over an 11-year period to save one life according to the study. So that's a pretty small benefit, even though it's statistically significant. And when you adjust for quality of life, meaning if you end up getting treated for prostate cancer with surgery or radiation even, you can have complications that may stay with you for the rest of your life, such as impotence or incontinence. The life expectancy is not clearly improved. In fact, it is possible that it is decreased according to quality of life years adjusted. So it's really not quite as great of a test as we had hoped, both the blood test and the rectal exam. And so really the choice of whether to do that test or not is yours. Some men who really want to just do tests that are well proven to do more good than harm, they're well within a reasonable decision to not do any of the PSA or rectal exams, especially if they're doing fine and not having any symptoms. But those men who find themselves kind of worried about prostate cancer, perhaps they know a friend or even a family member that had prostate cancer, and they or their spouse worry about prostate cancer and they want to be proactive, they decide, I'll do the annual PSA and maybe even the rectal exam. The rectal exam is not quite as accurate as the PSA, so some men opt out of the rectal exam since it's less comfortable than just getting a blood test. But there are cases where the rectal exam can find a cancer that is not found by a high PSA. So really doing one or both of these tests is reasonable, but it's not quite as evidence-based as some other screening tests such as colon cancer or breast cancer screening. So really the choice is yours, and I'd be glad to address your questions about this topic at your annual wellness visit and help you make a decision that's best for you. All right, thanks for tuning in, and we'll talk to you next time.